Let's talk about epidemiology. The objectives of these slides are to discuss the timeline for the COVID-19 pandemic, discuss the public health impact of COVID-19 infections, hospitalizations, and death, describe population that is high risk for disease, and how COVID-19 has affected race and ethnicity. So first of all, the first case was reported in December in Wuhan, China. After that, the first case, first fatality, was reported in January 2021. In February 3rd, the U.S. declares public health emergency. On March 11, the WHO, which is the World Health Organization, declares COVID-19 a pandemic. So in March 27, President Trump signs CARE Act into law, which was a support given to the population due to the severe consequences the pandemic brought into the population. On April 29, the National Institute of Health, or NIH, trial showed early promise from the remdesivir, which is a medication we're currently using in hospitalized patients and severe disease. On May 28, the US COVID-19 deaths passed the 100,000 mark. On November 18, the Pfizer-BioNTech vaccine was proven to be 95% effective. And on December 2020, Pfizer and Moderna vaccines were approved by the FDA for emergency use. Here's some data in the United States about the COVID-19. So COVID-19 affected the most people aged over 65 years old, and it accounted for 31% of all cases, 45% of all hospitalizations, 53% of intensive care unit admissions, and 80% of deaths. The highest incidence of severe outcomes were seen in patients older than 85 years old. Some of the public health impact were most seen in the hospitalizations, where the cumulative rate was 278.7 per 100,000 in the population. 32% required intensive care unit, and 50% died. COVID-19 associated deaths as of December 10, 2020 were almost 300,000 people. The infection fatality ratio ranges from about 0.5% to 1.4%. Very important is that this COVID-19 pandemic has brought a huge impact on our economy. And it's said we have spent more than $16 trillion by information by the U.S. Treasury. In March 2020, the U.S. passed the CARES Act with a $2.2 trillion economic stimulus bill. And in March 2021, the U.S. legislators passed $1.9 trillion pandemic relief bill. And here is a picture by the CDC that shows hospitalization and death by age. So 8 out of 10 COVID-19 deaths reported in the U.S. has been in adults 65 years or older. Here we can see the hospitalization and death by age group. So as we can see in this picture, cases, hospitalization, and death on the left side, we see that in an increase in age, you can see a more hospitalization rate and a more death rate by an increase in age. It is more significant in persons aged 50 years of age or older. As you can see in this picture, patients that are 50 to 64 years older are 25 times more likely to be hospitalized and 400 times more likely to die in the hospital. And the most severe group is the 85 years or older, which are 80 times more likely to be hospitalized and 7,900 times more likely to die due to COVID-19. We can see in this graph the hospitalization and death by age that the risk for severe illness in COVID, as we spoke previously, it increases by age. As we can see, the hospitalizations in people 85 years older is significantly higher with a rate of 513.2. This is a picture collected from the CDC, which shows a graph from March 1, 2020 to March 13, 2021 that describes the deaths per 100,000 population in the U.S. As we can see here, the first and most severe line is the purple one, which is 80 years of age or older, and it's the line that is more affected during the pandemic. As we can see, the second line is the age 65 to 79 years or older, which are the most affected population in the COVID-19 pandemic. That is why it's so important to take care of the elderly people during this pandemic. So as we can see in this graph, this is the COVID-19 weekly cases per 100,000 population by race, ethnicity in the United States. So from March 1, 2020 to March 17, 2021, the most affected race were the American Indian, the Alaskan Native, and the non-Hispanic, as seen by the yellow line. At the beginning of the pandemic, the most affected races were the Hispanics and the Blacks, as seen with the green line and the dotted line. As the pandemic went through, still the second most affected races were still the Hispanic and Blacks.